Today's programming is brought to you by the letter D. D M A R D S DMARDs.
DMARDs.
Hi, Elmo.
Oh, hi, Rocio.
What are you doing?
Well, I'm looking at this word, DMARDs.
Do you know what it stands for?
No?
Let me tell you.
Okay.
It stands for disease-modifying anti-rheumatic drugs.
Oh, and what do they do?
They are drugs that help treat rheumatoid arthritis.
What's rheumatoid arthritis?
Rheumatoid arthritis is a chronic systemic autoimmune disease that affects your joints.
Ooh, that sounds painful.
It sure is, Elmo.
And what causes it?
No one really knows what causes it.
Well, what does it do to your body?
First, it starts by attacking its own cells and making autoantibodies called rheumatoid factors, or RF. RF then brings leukocytes into your joints. Once the joints are infected, it causes inflammation and damage.
Ooh, Elmo doesn't like damage.
Nobody does, Elmo.
And, well, is that it?
No. Over time, Elmo, your cartilage will break down and causes erosion in your bones. And if the disease isn't treated, it can spread to your other organs and cause infection and pericarditis and lung disease.
Oh, no! Well, Rocio, is there a cure?
Unfortunately, there is no cure, but we have drugs like DMARDs to help treat it.
And that's the word. Well, what are DMARDs?
DMARDs, well, we have a performance by the Rah-Rahs to help explain it better.
Up in the morning and my joints are hurting. My RA is acting up and nothing seems to be working. Before I leave, Papa leave with some NSAIDs, cause it will help treat my pain and help it not to come back. I'm talking about swelling on my toes, nodules on my elbows. It's spreading everywhere, oh no. I'm gonna go and check my nurse out, see what other drugs are out, cause I'm starting to feel a bit weary. My pain, it won't stop, it just keeps me up all night. Hold on, sit tight, we will try to get this right. We'll try these DMARDs and see if they can get the job done right. Plaquenil is a prototype for these drops, blocking polymerase and protein synthesis. If you have vision damage or hepatic disease, then don't take this drug. Don't take this drug. If not, we have Rheumatrix. It also works well by blocking folic acid synthesis and replication of cells. But if you're planning on some babies or your kidneys are impaired, don't worry, there's other options. No need to feel despaired. Sulfadine's a sulfa drug. Prostaglandins aren't forming up. It keeps inflammation down. But if you have hypersensitivity, obstructions intestinally, leave this drug definitely out. Okay, here's your meds, let's talk about effects, so you know when it's time to maybe interject. Don't just brush it off, it could mean something else, so tell your nurse. There could be some itching or maybe some blurred vision, nausea and vomiting are some other conditions. Hair loss and headaches can be impositions, but diarrhea's the worst. It really is the worst. It lifts you up or it brings you down. This condition, it's complicated, but with my new drugs I got a chance to be remediated. They lift you up or it brings you down. This condition, it's complicated, but with my new drugs I got a chance. I got a chance. 'Cause the party don't stop when I got DMARDs. Hey nurse, look at me, I am feeling alright. These drugs really work, I sleep better through the night. Is all my swelling down and my joints are feeling right. I just feel so fine, feel so fine, that's great. I am happy to see you doing so well. I guess it was good that we went with platinum. Don't stop, keep it up, stick to your drug regimen, and don't forget to mobilize and eat right.
Mom, catch! Ah, my hands!
What do these two women have in common? Well, they both suffer from rheumatoid arthritis. Biologic DMARDs are one of the newest therapies available for those suffering from RA. Here we have a picture of a healthy joint. Here's the bone, the synovial fluid, and the cartilage. During RA, the synovial fluid starts to build up in between the joints as part of the inflammatory process. Over time, a pannus or thickening of synovial tissues occurs. With time, it thickens and proliferates, migrating across the articular cartilage to eventually produce erosions, bone and bone marrow invasion, and joint and capsule destruction. Biologics are aimed at stopping inflammation from occurring at joints by working at different points of the inflammatory process. One of the drugs, Orencia, will block T cells that reduces the activation of other cells in the inflammation process. TNF-alpha inhibitors Cimzia, Simponi, Enbrel, Remicade, and Humira, as well as interleukin-1 inhibitor Kineret, all work to block inflammatory cytokines from causing tissue damage, and Rituxan, a B-cell inhibitor, stops the production of antibodies, and this results in the reduction of symptoms of those dealing with RA.
Catch! Thanks, Humira!
Thanks, Enbrel.
Side effects may include nausea, hair loss, diarrhea, and an increased risk of serious infections. Biologics are not for those with a history of MS, lymphoma, symptomatic CHF, and those with severe or recurring infections. Take biologics and take back your life.